We'll get started. Hello, everyone, ladies and gentlemen. Good afternoon to all, and very warm welcome to today's Healthcare Masterclass. We are thrilled to have you join for another enlightening session on versatile leadership sutras for disruptive 21st century decades. My name is Raghav, and I'm honored to host this event powered by Healthcare Continent. Today, it is my pleasure to welcome our esteemed speaker, Dr. Rajiv Chibber, whose diverse educational background and multifaceted career itself exemplifies versatile leadership. He has embodied it all. To your surprise, he holds a BA in English from University of Delhi, Masters in Journalism and Mass Communication, and then advanced diplomas in Journalism and Public Health from prestigious institutions like University of Maryland, Emory Universities, as well as doctorate from UNESCO-associated Aztec University in Mexico. A very warm welcome, sir, and thanks for taking out time today to share your thoughts and wisdom with us.
Thank you.
Chibber is currently serving as Vice President of External Affairs at Sahajanand Medical Technologies, where he drives strategic initiatives and manages public policy, government relations, and outreach. His previous roles include influential positions at MSD Pharma, Public Health Foundation of India, and multiple others, showcasing his expertise in strategic initiatives, public policy, and health system strengthening. Recognized globally, Dr. Chibber has served as jury member of World's Greatest Brand Award by PwC, Global Ambassador of Global Business Excellence Award, and had a unique distinction of being one of the first forefront in Indian medtech sector to be speaker at World Economic Forum 2024 earlier this year. So once again, very thanks for all of you to join, and thank Dr. Chibber. I'd like you to welcome and take over the forum here and guide us through the versatility and commitment, excellence that you have embodied in yourself.
Thank you very much. Thank you, Raghav. It's a real honor after what Rajiv sir presented, it's now me to take forward from where he left. So thank you everyone for joining on a Saturday afternoon, and especially when it's like a hot day here in Delhi, and other places are also brimming hot because of the political, flair that we have right now, which is also going to impact healthcare. That is what we were just discussing a couple of minutes back. Yeah, so absolutely, healthcare has become one of those areas which has now become a paradigm shift, and India not only has now the dubious role of managing health within India through Ayushman Bharat and related schemes, but also Ayushman Vishwa is what we will be looking forward to. And I'm really proud that India's contributions have become now global contributions recognized in the context of each and every sphere. Whether we talk about any developmental agenda, India becomes a fulcrum point at any forum globally. So I welcome you all to this session, and let me just share my screen. This is visible, right?
Yes.
It's visible to everyone? Yeah, thank you. So as I said, India is inching towards its 100 years, and while we do, walk towards 2030, when the SDGs are supposed to give much impetus to a lot of areas of development globally, India has now become a global health leader, and this was evident when we, talked about healthcare, which was really showcased during the pandemic. I mean, even last year itself, the theme of G20 itself, One Earth, One Health, One Family, One Future, that encapsulated what India is now biased for in the next decade to come. And by 2047, when India achieves its 100 years of independence, I'm sure will be more than, a $10 trillion economy, where our considerable efforts towards each and every sphere of development, and especially healthcare, will be recognized, and we will be able to be one of those leaders that are the global propellers also. So as my presentation says, we are looking at a global PPP. When we talk about global health, health cannot be just de-associated without priorities, policies, and partnerships. We have to go into a paradigm shift where our connections with the global community, our connections with the global West as well as the global South needs to be harmonized, needs to be channelized, and also needs to really come up with the fact that what we imbibe for, or what the Honorable Prime Minister, said, Vasudev Kutumbakam, becomes a reality much before 2047. So let me take you all towards why do we think that societies do need to invest in health? It's a very nuanced view that has been debated for centuries now, and at certain times when the world wars were going on, or when there was global unrest, even during the Roman times, health was something which was also discussed, neglected, and then brought back. So today, what we have is a couple of views that we, moved in over the last decades and centuries, is how health has moved from a utilitarian view, which, when the European Renaissance started, where it was largely looked at productivity, that more healthy people means more mills and more factories being open, to a view that came recently in the 19th century or the earlier 19th century, that health was largely a well-being view, where, beyond your productivity, you had to look at personal health and family happiness, to now a security view in the earlier 20th century, when we moved and deep dived into the millennium, where security view was about sheer vulnerability globally, and how countries are going to look at pandemics, epidemics, etc., and what are going to be the entire processes and entire partnerships that will leverage and make health a new global regime, to now a human rights view, which means health has shared values. Each and every sphere that we impact upon, whether it is, the COP at climate change, whether it is any of these wars, the first thing that we talk about is how health can be protected, how people can be protected. So both health has instrumental value, and as you see, it is something which we would want to leverage globally also. So when we talked about this philosophical construct itself, if you look at it, it started, and as I said, it started way back when Bentham talked about it, moved from the utilitarian view to the justice view and the rights view when Rawls talked about it in the mid 17th and 18th centuries, and then Amartya Sen talked about the entire capability and the rights that we need to look when we talk about global health, when we talk about health equity, because global health and health equity need to go hand in glove. So just to take something what Amartya Sen said, and this is written, that a well-ordered society will ensure that all individuals have the capability. I've marked the word capability because capabilities need to be created. And that is how we will have the justice, we will have the right to move towards capable healthcare paradigm shifts, to be healthy and at a level that is commensurate with human dignity in the modern world, which is their right. Today, we are moved towards the right side of how health is going to be everyone's right. In fact, at G20, when the Prime Minister talked about it, he said right is also not limited to mankind, right is also limited to plants, to even animals. So Vasudev Kutumbakam means engulfing everything. So again, today health equity has a couple of connotations when we look at it. So universal health coverage, everyone knows about it. I'll discuss that slightly later also. But universal health coverage has been one of the enigmatic areas which really triggered how healthcare can be a societal value. And that was largely because of the OOP, the out-of-pocket expenses, the financial protection that was required. It is necessary, but not sufficient. That is a very idealistic view that universal health coverage looked at when it started. Then we moved on to adding on to the universal health coverage to understand what are the social determinants of health. That is where we required global health actions. That is where we required multi-sectoral actions. So just as an example of India, I mean, India now seeks to become a global player. We are a non-aligned power in that sense. We have used our diplomatic platforms, including, G20, as I alluded to, or even the climate change negotiations, to promote the development agenda in the LMIC world. Why have we really promoted all of this? It is because all of this at one point of time talks about the social determinants of health and what are the multi-sectoral actions that we really need to do. So that approach, which resonates with India's long-standing support towards fellow developing nations in the LMIC setup itself, it also represents a shift because India can use global health leadership to counterbalance a lot of areas. We talk about China plus one. We talk about economic development. We talk about global turbulences. We talk about even the global influence. All this will become areas that we need to look at, and this will empower communities. This will ultimately, take us away from only health equity to community equity. Once we realize this as a global challenge, we will be able to then sort out. Look at, I mean, I can give you a very clear example. AMR, antimicrobial resistance. It has now become a global, phenomena. It's taken the world by each and every strand that is required to prevent AMR, to capitulate on how AMR can be really resisted, what are going to be the impacts if we do not have certain policies, and the globe is together when we talk about this. So they're talking about a rights-based approach towards health. We need certain issues more beyond AMR to become a rights-based approach towards health. So that is how health equity has taken its chart forward. And as William Gibson said on this slide, it is not evenly distributed. This word itself, I purposely put a dash here. The future is already here, but it is not evenly distributed. We need to distribute it in such a way that we have the right approach towards health connotations. Again, when we talk about all this, we need to look at which areas impact health towards people, towards society, and towards the globe. I purposely made people in a round figurate itself because people represent the globe. The globe means global health. And this is impacted by these two areas, which is the health system itself, where we have a workforce, where we have the infrastructure, where there are drugs, vaccines, technologies that are made, incubated, being available to each and everyone, financing health, as we discussed a couple of days back at the World Health Assembly, and India has progressively signed towards that also. Our information systems, which we were just discussing, Manish ji and I were just discussing how data and information becomes the next oil towards health, and the global governance parlance that we will now be taking a shift towards. All this will really, really shape how health systems become a global impact. And to make that global impact really, really impactful, we need to look at certain areas of health nutrition and health determinants. All these areas, if you look at it, whether it's water, whether it's sanitation, food system, environment, social stability, and development. These are societal determinants towards health. If we have one agenda globally to make an impact here, we will be able to really make an impact to the people. And when we make an impact to the people, the personal side also brings health to a newer level altogether. We have better incomes, we have better health. We have better education, we have better health. Occupations, today everyone talks about within an occupation how health is going to be a challenge, mental health is going to be a challenge. Those create a social status. Genders, we've got now more women leaders into it, and our networks. This network is very, very important if one needs to look at. And this network then takes us to the global challenges for health. Everyone, we saw how global challenges for health has really, really impacted us. And we've been able to also, look at certain areas where an indirect and a direct, interaction towards global challenges, they make an impact. India has, and for me, when I go to these global conferences or when I talk about India, we talk largely about these 7 agendas where we need to really tick box and discuss what globalization can impact, how urbanization can have an impact, how poverty will have an impact, social economic inequality, food insecurity. So all these 7 areas are areas which we are working towards, whether it is at the WHO level, whether it is at the BRICS level, whether it is at the Quad level, whether it is at any other area of global collaboration that makes an impact to health. All these are, in fact, the vital tick box that we need to really, really, work towards. We need to really make societies understand that this is going to be the next agenda that the world can actually talk about. Oops, sorry, this isn't moving. Yeah. Yeah, how can I go back? This is like this went.
Any challenges, sir? Just click.
Yeah, I just wanted to.
You can slide from current slide or.
Yeah, no, yeah. Yeah. So, just to overcome all these challenges, what happened is, and I'll take you back all to a bit of a history. Again, the global path towards all these challenges was universal health. And each and every country, and if you look at this particular ladder itself, each and every country at a particular time frame moved towards UHC, global health or universal health coverage. And India, as you can see, in 2012 adopted the UHC paper. I'm really honored to be one of the co-authors of Chapter 7 of the UHC document itself that India released. It was accepted by WHO. We showed our stealth, and we were able to also make an impact that how we are going to take forward, economically and diplomatically, India's healthcare policy itself. And obviously, I mean, we at that point of time, we were trying to compete with global powers, and these, I mean, whether it's US, Japan, Russia, we wanted to compete with everyone. And today, after so much of deliberation on UHC, so much of health technologies and assessments being done globally as well as within India, we are now well poised to play a transformating role in shaping health, the future of global health, and also strengthening global health governance, championing equity within the LMIC setups, sharing our expertise in the pharmaceutical as well as health systems innovations, and also now taking a leap forward in research and making it more climate resilient. So all these became and engulfed a part of our march towards the universal health coverage or the path towards universal health coverage. Largely just for the viewers, to talk about what universal health coverage is. Universal health coverage is basically an agenda by global governments to basically remove out of pocket expenses. So this cuboid is a very classic example of how you can actually remove out of pocket expenses. You can include services, you can include financial protections, you can reduce the cost and sharing of fees by having, as in India, we have the Ayushman Bharat Kendras or Ayushman Mandirs, which is there. And we can also increase the coverage mechanism to an extent to those people who are not covered and can also be covered very well. So this itself is a cuboid which will actually give you what universal health coverage is and how can we really work towards the services that we need and work towards a global agenda whilst working within India to also uplift people from poverty, which strikes them bad when it comes to health. So while India did all of this, what was required that we had an equal start? As you can see, and let me go back to this slide again. As you can see, countries as good as Japan, Germany, UK, Kenya, Australia, our neighbors like Sri Lanka, they embarked upon this global universal health path almost 50 to 60 years back. They have achieved very good health parameters in their countries, and their health systems have also looked at this cuboid very stringently. They moved into each and every sector that required attention towards health, and that is why India now needs to leap forward towards this finish line itself. So here's India's situation. We have been a growing economy, and we've been growing rapidly since the 1980s. Everyone is privy to all of this when we saw how India became a global leader after 1980s, and the 1991 policies made India more and more uh, uh, talked about within the global conodromes itself. But our health status has really threatened our development, and this is where we've been able to now focus upon the national health policy which came in 2017. Even before that, through the RSBY we were trying to look at it, but now we need to really look at a fact that post COVID India has become that kind of a economy which will also have an impact globally, for which we need to really make our health status huge leap in terms of each and every dynamics. Look at us right now. We've gained 30 years of expectancy. It's great when we talk about 30 years of life expectancy, but is the quality of healthcare provided? No. Today we are underperforming based on our even health income peers. And this is a chart that was released, I think, just after COVID. India's position, if you see, is almost between the middle. Or if I could be very clear and very poker face, India is really way beyond where it needed to be by this time of the of 2024. We see China, we see Japan, we see USA, we see Sri Lanka, we see even other countries which are even war ridden, but then they've also been able to have a major impact on their health and social determinants. Our non-communicable diseases, cardiovascular diseases, that's dismal again. By 2024-25, we've already inched to become the diabetes capital of the world. By I think 2030 will become the cardiovascular capital of the world. So let's move towards becoming a productive capital of the world rather than an NCD capital of the world. So if we keep on neglecting all of this, we will still have a huge impact on our productivity loss, something which India needs to really go back to the utilitarian view of what health was and how health can now take forward to become a basic right. Again, our public health spending at within the GDP is dismal. Right now, we have a 1.2. I think this year, with a couple of new schemes launched, it has inched towards 1.5. But then the budget session is in next couple of months. So let's see how we move towards it. This exactly shows that how expansion of universal health coverage vis-a-vis the government's vision to provide public health expenditure needs to be really, really mooted, and we need to move fast. Otherwise, that will become a major, major developmental agenda which we will not be able to tick box. Again, if we look at it, our out-of-pocket expenses have really gone huge and out. We're largely a private sector oriented healthcare mechanism that is here in India. We have a lot of people who cannot afford healthcare. If you look at even basic healthcare facilities, the kind of expenses that are required is not even bearable by the poorest of the poor, and especially those who come under the Ayushman Bharat scheme. So we will have to really, really set our standards high when we look at it. It may mean also to do price caps if required, to curb certain areas of public spending, so that public health can be rebooted. So all this is a major requirement when we come to the affordability, accessibility, and availability of public health. So moving from the entire universal health coverage, these will become the guiding principles if we take forward public health in the letter and spirit towards how it was really written back in 2012 when we released the universal health coverage booklet. We talked about universality, we talked about equity, we talked about the non-inclusion of the and non-discriminatory factors that are going to really take us to the next level. Patient rights, I've harped on it a couple of times, but that will also be very important, because patient rights cannot just be at a place itself. It requires portability, which means our public health centers need to reach there, or technology needs to reach there, and continuity of care. The financial protection is an important thing. India needs to, as I said, move its GDP beyond 2.5. I would say by 2030, we should look at 3% of the GDP really, really putting up in healthcare expenditure itself. Accountability is there, and transparency when we talk about Ayushman Bharat. And community participation is very, very important. And by 2030, we should be able to link the SDGs towards a healthier society. Each and every SDG today inevitably talks about how can it impact healthcare, productivity of a country. So SDGs is very, very important to be tick boxed. Now so this is how we've fared over the past couple of centuries. But then the new thing that has really come up for India is how we are going to link SDGs towards universal health coverage. This I just discussed, towards expanding the entire global paradigm shift towards global health governance. And this is going to be, the year when India needs to take it beyond diplomacy. We need to take it into a real-time nutshell of global governance, where we leap out, we talk about our science, we talk about the totality of society, which was discussed way back in 1974 at the World Health Assembly, where everyone agreed towards financing and other areas of SDGs making an impact towards comprehensive healthcare. This paradigm shift can happen. We will be taking it forward this year itself. There are enough partners that we are working towards, and this will really, really make India one of the next economies that will have the best healthcare, not only services in the country, but also providing it globally. So what global governance towards health it really talks about? So we've heard a lot about how global health governance can be looked at. I mean, where we talk about global health as a priority, we talk about how health disparities amongst countries can really be bridged, and towards the word which they use is erased. We are right now at the bridge level itself. I hope the bridge comes much nearer where we erase disparities. We've got now intergovernmental organizations working almost throughout the year in each and every region, in each and every aspect, whether it is WHO, World Bank, UNICEF. They provide leadership and financing support. We have added our stealth in achieving the SDGs. And today, if you look at it, India and the globe have come out with these international organizations like the Quad Alliance, the Global South, province itself that we talk about, G20 plus, when we've looked at emerging nations also being into it. The World Economic Forum itself this year talked about health as a primary agenda. Then we have a lot of other organizations that give health the required impetus, that give health the required stealth to move forward. And this is going to really help us negotiate better towards preparing how the global health governance is really going to shape in the future. So I think global health governance has now taken off globally, with not only India but other countries also making a silent but an assertive attack towards how global health is going to be the next agenda for them. So the roadmap is clearly envisaged, and I also was a part of the BRICS global meeting just a couple of weeks back, where they talked about the universality of global health, where two things which they really wanted in a cliche format was the breadth needs to be expanded, where everyone talks about global governance but acts on it also, and the depth needs to be adopted by each and every country. This will holistically improve the coverage of health, not only in LMIC countries, not only in the emerging economies like the Africas, but also in areas where there was negligence despite being developed countries. We saw how the entire European Union really crippled during COVID-19, and how it was not able to even take forward certain areas which impacted health, which impacted the supply chains, which also impacted how governance could be there. And the other thing that the global health governance talks about is equity. Again, in equity, they talk about the breadth, depth, and coverage of this. And this is very much important because, as I said just a couple of minutes back, we need to bridge this gap, cement this gap to an extent that when global health governance talks about erasing the gap, that should be our roadmap. And I think a lot of countries have moved towards this. If you look at areas where they've really worked around, is not only high income countries but also LMIC countries and the global south, which has made an impact or which has made itself heard when there is a roadmap of repositioning themselves into this transformative area. This then further takes us to how to bridge this gap. The bridging gaps can actually take the scope of negotiations from north-south to now south-south relations. And this is very important, because earlier when we were only focusing from north to south, this was largely taking us from TOTs, the technology transfers that we were getting, or more and more, north having a dominance on south. Today, when we look at this entire scope of negotiations that are going or that are really brewing globally, the negotiations are out of a whole society. It is not really only a funnel towards a particular country or a particular region. It is the whole society itself. The negotiating powers are now across governments. Governments are now taking shots, whether you're a part of the Quad Alliance, whether you're part of the G20 Alliance. The governments are taking a shot on how well-being can be negotiated better, and then negotiating within the healthcare spectrums within the countries itself. it's a pull and a push. I was in Brazil, and we saw how even Peru, Uruguay, even the smaller countries, the island nations, they were trying to make their voices heard, that in our regions, in our countries, in our towns, talukas, we also need these kind of negotiations which make an impact towards global health governance. So I think this north-south, south-south relations and negotiations that are now brewing, this will have a major impact on how healthcare and global health governance will really, really take forward. So to compare the north-south and south-south relations, a couple of things that really came out well was when we talk about the north to south, we need good collaborators from north to south. This is very important because unless technology and collaborations happen, there cannot be a real-time focus on how health can reach the last mile. Uh, the south can actually help to develop and nurture institutions. I talk about uh, beyond AI. One thing which is beyond AI is academia and industrial relationships, and this is what the North brings to the South. Higher investment, obviously, everyone in the globe till now, even WHO looks towards the North to provide more and more finance and investment opportunities. They have problems, so these problems can actually be offsetted through how we address when we address health as a local agenda, when we address health which from brain drain becomes a brain gain. So that's something that is very, very important. And the advantage is expertise. Everyone gets expertise. Everyone gets to tick box what we talked about in the earlier slides, right? In the beginning of what are the societal impacts towards health globally. South-South, if you look at it, and it's very clear. I mean, India played a very pivotal role last year itself in G20 when we talked about peer-to-peer relationships, when we talked about how our next level is going to be more mature within the southern region itself, the South-South region itself, how costs are going to now play a big role. When we talk about affordability and accessibility, cost needs to be there. Problems are a bit there. Again, we are politically disgruntled at this point of time. There are almost 40 plus countries in the South that are going for elections, including North also, a couple of them that are going for elections. So politically, it's an agenda that will really have an impact if done well. But the advantage is that within the South, there are similar cultures. There is less fear to reach changes. We know that, if it's India and if it's Brazil, this is the change that we want in the next uh, uh, 10 years by 2030 or 2035. And this is the change that we want by maybe 2047. And Brazil also reaches 2050. That's Brazil's agenda. So, we can really, really work in this north-south and south-south collaborative format itself. But the key idea is how collaborations can really make it go beyond, the regional epicenters that are really brewing. So this brings us to how the regional epicenters can really take forward when it comes to north-south, south-south health delivery systems. We've seen entrepreneurial, approach towards health delivery system, which is largely in the US, which is where governance is involved minimally. They've got, affordable, the Obamacare, which is taken forward. It actually provides affordability. And in fact, right now I hear, and this is confirming also, like India and a couple of other countries, US is also looking at price capping a lot of products, a lot of systems, and a lot of manufacturing. So that also brings them towards how business orientation of healthcare on insurance can really make a tectonic shift. We've seen the Bismarck model itself. I talked about it earlier when we looked at the public health, the universal health coverage ladder, where government regulation was there, where taxes and personal money become more and more evident when we talk about healthcare delivery systems, but they are also moving towards price capping towards certain therapeutic areas. The beverage model is a very popular model that has really been able to shape a lot of economies. We did try to ape that, but I think India came up with its own model. So, like UK and Thailand, they have a complete government-led model of healthcare, which is paid through taxes and is under total government control. This is an comprehensive package, but then this does not allow, or this makes innovation a bit throttled. This is where we look at the Ayushman Bharat model, which is almost a mix of all these three prior models that we just talked about, where we talk about a free market approach also. It is welfare oriented, which has a packaged model. A package model means that you have the best market practices packaged into a particular therapy itself and utilized. It is under government control, so the welfare orientation remains into it. It is comprehensive, so the beverage model of having paid through taxes is also going to be there. Now we are planning towards making it from 5 lakhs to 10 lakhs, and also taking forward a couple of other communities like CGHS, like everyone above the age of 70. And the best part is that this particular model, while appointing a health insurance body, takes preventive healthcare, curative healthcare, and Ayush also as a subset of healthcare totality. So I think if pitched well, if taken well, if taken in the true spirit, Ayushman Bharat model can actually become a global model where India can share not only its expertise, where the globe can also look at how the center state conundrum can actually be bridged or erased. So the conclusion is, how can we make health as a global diplomacy when we talk about global health governance? All these areas are real-time areas that we all have talked about, we all have heard about at one particular point of time. But the real-time need, and I won't go into each and every point because each and every point here is self-explanatory. We need to move towards each and every point at a pace where we can achieve health governance within a stipulated time frame, within areas where we can not only become Atmanirbhar in these areas, but we can also provide resilience globally, making the world a closer and a big family when it comes to global health governance. So if we don't create the future, the present extends itself. This was something that I really liked, because today, if our dismal health systems in India does not take a new shape, we will still have hindrance in development, which means our prominence as a global country will really be defied. So in conclusion, international health, global public health, collective health, and global health diplomacy all means one earth, one health. As I said, all the 17 sustainable developmental goals embark towards healthcare for all. And we talked about Vasudev Kutumbakam. We need to really take this forward in its letter and spirit that was given and inherited from the Gita to the world. So thank you very much. This is something about me. Raghav did, talk about all this, but this is my real-time work. I really am trying to make an impact on how public health policy and global health policy can become one of the breadwinners for a lot of people. Thank you very much.
Thanks a lot, sir. And this is very enlightening, and really amazed by the picture you have on the right, what people think you do and what you actually do. I can see you banging your head on the wall there. I'll open up the forum to
So
questions.
should I stop sharing, or is it okay?
Yeah, please feel free to shop.
Yeah.
I'll open
Thank
up
you very much.
forum for questions.
Yes.
To share insights and their
Yeah.
thoughts very much. I can see messages coming. Amazing presentation. Thank you. Feel free to ask questions. Feel free to unmute yourself and engage with sir. Any questions, any thoughts you had on presentation today? get started, sir, maybe I can ask a question that
Yeah. Sure.
you mentioned the one earth, one family, one health, the conclusion slide. What how is different countries reacting, different bodies responsive to this vision? Have you seen like contrary thoughts or questions or challenges or something like that when you engaged with a variety of stakeholders all across the globe?
I think this has become a very important area when we look at the challenges to the strategy towards One Health. You know, uh, the problem is that despite several improvements or significant improvements, globally health systems are grappling. Globally health systems, they really are not able to to defy the huge gap that comes to us on a regular basis. Today we saw the pandemic, COVID-19. Tomorrow we are going to deal with zoonotic diseases. In between, today we are dealing with AMR and the related areas of antimicrobial resistance. Just see how health has now become a shift altogether when we talk about security. This security does not only mean porous security. It's not boundary, it's boundary-less security. So globally, I think countries are getting aligned towards it. And as one of my slides said, there are now enough areas, the I2U2, which was defunct, which is, India, Israel, UAE, USA, was made to actually provide better technologies to almost every global country that required it. And this meant even the developed nations or even the developing nations or even the poorest of the poor countries. You talk about, and I alluded to one thing, that even the island countries are now talking about healthcare challenges. Look how global warming is making an impact to them. They are moving from one place to another place. There are disparities between healthcare provisions being provided. The migration itself is creating a huge issue. When wars are happening, whether the wars are happening in Palestine, whether the wars are happening in Ukraine, people are migrating to Europe. We saw how people migrated from Afghanistan to a couple of countries. All this takes a toll on health provisions within those countries itself. So I think when we talk about health as a global demand and supply, it will never end.
Totally. No, I think it's a pressing issue. I can relate to many of those myself experienced across working across different geographies,
Yeah.
and it's totally like that universal approach.
Yeah, absolutely. Universal health coverage needs to mean universality.
Totally.
Initially in the 1930s, when UHC was started by each and every country, they focused only on their countries. They did it right, but what we need to do more is have an amalgamation of UHCs for a universal health coverage.
Definitely. Definitely. Manish,
Well, Dr. Chibber, it was indeed a tectonic presentation.
Nice, sir.
Believe me, like I was amazed actually, and the kind of data you have put up, I think it has got a lot of insights. And yes, to align with, to navigate with these, say, challenges and changes along, you really need a very versatile leadership. I mean, I was just going through the data you put up in such a beautiful way.
Yeah.
No doubt about One Health is going to be a big challenge. And yes, what you rightly use the word, it's borderless.
Yes.
It's borderless, and health has again, it's assumed the center stage of all economic activities.
No,
And
absolutely.
yes,
Health will remain one of those agendas
yes.
which
No,
have
it
to
has come
be
to
looked at.
it has come to the center stage.
Yes.
Because pandemic onwards, I've been following up the economic challenges in Europe, America, and other countries, and you know that they're still recovering. It's been a long
No,
time
as I
actually.
said
It's not
yesterday
almost three
only,
years.
as I said, Manishji, yesterday only when I was speaking to a very senior military officer in the US Embassy, he in fact linked global health to military and economic concerns.
Yes.
So I think everything right now talks about global health. We can't miss it. Even climate change talks about global health.
Yes.
Look at the number of people being dislodged because of climate change. When
In
they
fact,
meet, Rohingyas is a classic example. They, when they moved into countries classically deprived, today, economically backward, not getting all those facilities that are required, it needs to be looked at in a very different prism altogether.
in fact, let me also tell you about One Tao. You know that it's a country on island country on IOR, and they and a couple of other countries, I think, if I'm not mistaken, some 35 plus, they have knocked the door of International Court of Justice.
Yes, absolutely.
Things are not easy. I don't know how, say, global economies would respond to it. And climate change, which we used to think as a peripheral issue, now again it has joined the mainstream. So it's going to be integrated, complicated, affairs.
One big thing that everyone
And I
talks
will
about
feel
is
like
climate change,
probably
sir.
there could be a multi-ministry, say, I would say like group, what do you call, GMs and all. Maybe I'm forcing actually to tackle only this health.
Yeah. I was amazed. I heard during COP, the recent COP climate change conference of parties for climate change, the R&R, which is rehabilitation and relocation, it has gone beyond, some countries' populations.
My God.
So to just cater to those people who have moved into those countries is going to be a huge challenge. Supply chains are going to be impacted. The professionals who need to be there. So countries which at one point of time, especially like France, Germany, etc., who now have an influx of people who've migrated there, their ratio per doctor ratio per population has gone down considerably. This will have an impact, not now, but 5 years down the line. If there is, another pandemic, another zoonotic epidemic, there will not be specialists who will be able to treat that bigger population altogether. So we need to now prepare ourselves well in advance.
Yes, disruptions are of tectonic proportions, no doubt about it.
Yes.
And we need to gear up.
And
There,
India,
there
I
no
mean, if you look at
there no
India,
way.
we are providing all of that. We are providing all of that. And one thing which is very clear that once this government sets in, we already have a Sanjeevani agenda, which is the
Yes.
global agenda of health sharing. Health caring to hai, health sharing bhi rahega, global agenda. But that is really going to be impacted through our diaspora, which is outside India. This diaspora is as big as countries' populations. कई कंट्रियों की population के जितना बड़ा हमारा diaspora है आज की date
In
में
fact,
इंडिया में.
it's around 3.5 CR.
Yeah, so that's what I'm saying. So it's as big as this, and this diaspora is going to make an impact. I mean, when we talk about the next thing that the government is going to move from Ayushman Bharat is Ayushman Vishwa. So Ayush will become another area where this Ayurveda, yoga, and other holistic health practices will be a part and of this that gives India a unique place in the global health space itself. The combination of these practices along with conventional Western medicine, it has already started to gain a larger influence. If you look at it, people have started to look at it very, very holistically. I mean, India isn't just a provider of medical products, services, and health information technologies. It is also a source of talent in the healthcare sector itself. So whether it is nurses, whether it is doctors, researchers, people at influential positions. Day before yesterday, on our group itself, we were discussing how UK's secretary had come over, is requesting India to provide more healthcare providers. They are not having that kind of people itself. So so India and its diaspora, they will play a very pivotal role in shaping the future of global health. I'm very, very, एक मतलब होता है एक ऐसी धारणा है कि बिल्कुल होगा ही होगा ये. So that will be there.
You have used very good word actually. Probably I'll be using in my further communication. So Indian health would be nothing less than a Sanjeevani. You remember that, what do you call, I wouldn't say it's a cartoon and all, but there was a graphic actually when India was supplying the vaccines to Brazil.
अच्छा, मैंने
So
ध्यान नहीं
India is
दिया.
going to do the same thing again and again.
So if there are any other questions, I think it's already 55. We still have 5 odd minutes to the session.
I wanted to take a check once again. Any questions? I think Navam Publishing. Sir, would you like to ask your question by unmuting?
So he's actually, I'm just reading his question. Please share your views on up to what extent the evidence-based healthcare assessments contribute to SDGs goals linked with healthcare or even with Global South healthcare goals. Still, some research is required on region-wise and even geography-wise requirements, whereas current studies are only on some specific but unsynchronized regional healthcare aspects. Yes, I think disease demographic profiling will really be a new area of research that everyone and each and every big global university will start moving into. What is happening is with people migrating, and if you look at it, people who've migrated from possibly Europe to the Asian countries and all that, they were largely big meat eaters to areas where you've got, I'll give you an example of cardiovascular disease itself. Why has there been a spring in cardiovascular diseases? And the main reason is how lifestyles is one, but demographic profiling really changing. Westerners, when they come here, settle here, they have such kind of arteries, they have such kind of veins which are bigger. And when we do the conventional, cardiovascular methodologies on such patients, it will not impact. It will actually be counterproductive. So your question on how research region-wise is required or geography-wise is required is absolutely correct. Today, region-wise and geographically wise, we need to have disease demographic profiling done because there's now too much mixed migrations that have happened. A lot of diseases and a lot of pandemics have moved from one part of the globe to another part of the globe. That is called health migration with people's migration. We used to hear that rats used to migrate. Now it's brats that are migrating and making health more and more uncanny and unsavory. So I think region-wise studies are important, but these region-wise studies need to be done holistically so that data can be curated at one particular place. So when we have a global health governance body, or when we have global health governance at the epicenter, I think all this data will then be able to provide much more realistic, global semantics towards how things can be managed. So regional will not now exist. Regional will only exist for a country specific only.
So here one additional question now arises. I was not able to unmute at that time. So actually, even if we can read the current articles which are getting published in different journals, the current research which is happening around is being led by some maybe individual university or colleges of particular region. Like if I'm talking about a particular region in global south, in Africa and different countries. So because they have got their own purpose, which is not just a global south perspective. They have perspective for their purpose, their institutional reasons, maybe necessities or requirements. So they're doing research for a particular purpose so that they can contribute to some study, and their university may have a significant contribution on maybe research and all. But here it requires a global unbiased body which can sponsor a country specific, maybe a geography specific studies, how healthcare systems are currently in that particular country or particular geography, and what changes are required. if this can be done in a particular timeline, suppose in next 1 year in 40 countries, similar search can be done. And so these research can contribute on the applied form of the outcomes where this body can decide now on the basis of a study, what exactly, what ratio, what proportionate, which kind of contribution is required. Suppose somewhere diagnostics is very strong, but medication or maybe therapies are not up to the mark. So there we can focus on therapies. Somewhere we can focus on the technologies where resources there. So where we can pool some resource in different. So this kind of study, a big perspective study is required. What I suggest, what I feel, and I think a global body which can be considered or accepted by everybody as an unbiased, and which doesn't with south kind of perspective, I think democratized by this way. So this kind of studies have the scope. And in SDG goals, which you mentioned, I believe this can help a lot. This can help synergizing the healthcare initiative in future if something comes up. So this is kind of just a.
I think a part of it is answered through the recent World Health Assembly that just finished on 2nd of June or 3rd of June, where India had a very prominent participation. If you look at it, one agreement that they talked about, I can't recall the entire line itself, but one agreement that they talked about was an agreement on sharing pathogen access. Now, this is very important. This is an area which requires much convergence beyond academic institutions or beyond regional institutions. When we have pathogen access, when WHO has pathogen access, the next agenda for them or the next global priorities for them will be very, very different, and that will encapsulate what you're trying to say. The other thing that they talked about is emergency responses towards pandemic. This again is an answer to what you are talking about. When we tick box SDGs, when we tick box our own goals or regional goals, we need to look at how emergency responses globally can be mooted. So a couple of things that I think you can really resonate when we talk about the World Health Assembly and your question. Despite the progress made over the last 2 or 3 decades, a clear thing that WHO now recognizes through the World Health Assembly this year is that we need to really work towards resolution of global challenges rather than regional challenges. So they talked about health governance, they talked about climate change and health, they talked about health security. So all these are and health financing. So all these are very important in terms of mitigating anything that we move towards when we talk about global health governance.
Right.
In fact, I don't know. I'll try to pull out that 113-page document and share it within the group, because that's a very important document, the World Health Assembly. Because आज जो हमने 2 तारीख को या 3 तारीख को accept कर लिया है globally, that will now go on for the next 5 odd years, which means by 2030 there will be a new set paradigm for the globe to also reconvene and reposition itself when it looks at global health.
Right, sir.
Totally, sir. No, that's amazing to hear and learn. We'll be curious to learn more about that. I know we are right on time, so I'll just share a quick teaser about.
Raghav, just 1 minute. I just want to add one thing. Dr. Chibber is one of the key drivers behind our initiative, and that's a digital global health architecture.
Yes.
We've been working for the last 1 year. Yeah, carry on.
No, that's amazing, and I'm looking forward to collaborate with you more further on many such initiatives and taking global healthcare, not Indian healthcare, global healthcare to a new place and making a healthier. I think someone commented in the chat with so many, you mentioned diabetes capital, cardiovascular capital, healing capital of the world. So looking forward to collaboration on that initiative. And thanks everyone for joining. Today, I just want to share a quick teaser of the next masterclass. We'll share the registration link in the same all events page. And for next masterclass, we'll have Dr. Sunil Khetrapal talking about financial sustainability. I think we discussed a bit of financial aspect today as well, but financial sustainability to balance quality, accreditation, and cost. Once again, thanks everyone. If you have any questions later, please feel free to mail us or write to us and we'll get you connected with Dr. Chibber.
Well,
Thank
thank you
you very
so
much,
much, Dr.
everyone.
Chibber.
Yeah, thank you,
so much.
everyone. I see a couple of
Thank you.
known, names. Lalit is here, Ashish is here. A couple of known names are here. So thanks for taking your time on a Saturday and on a weekend, and encouraging me and I think the entire masterclass format itself.
Well, thanks a lot, sir,
Thank you so much.
and thanks everyone.
Thank you very much. Thank you. Thank you.
Not only me, but team is also here, just so you know.
Arey baap.